Morning. Macheroni. We are going to start with our meeting. If you talk a translation, please raise your hand. If you talk a translation, raise your hand. Batlo ufa mutshini wa toloki. And then go di toloki. English is number 1. Sesotho, Setswana, obviously le Sepedi is number 2. isiZulu, isiXhosa, I think obviously Nesindebele and Iswati, which will be go number 3. Afrikaans number 4. Chivenda and Xitsonga number 5. English number 1. Sesotho, Setswana, Sepedi number 2. isiZulu, isiXhosa number 3. Afrikaans number 4. Chivenda and Xitsonga number 5. Nibikreile ne? Okay. If you talk toloki uskai keep emisale tsogo right through batlo ufa motšhini. Motšhini o bereka mo a o bereke ko ntle ne ge chaya a re šie motšhini gona ka mo because o tlo ba useless ko hae o latla. Ke khupela hore setšhaba ka mo khone mola ke pleke ya di officials le di honorable members rena re ska batamela mo plekeng yela re batho ba bagolo a kere a ra tshwanela hore re kgalane ka dilo tse di sa reng selo ka mola ke pleke ya di officials ba batlile mo go araba di questions le di members ba ba leng mo pele go lena mo. Let me take this opportunity to declare this venue to be the precinct of Gauteng Provincial Legislature according to Rule 56, Section 1 and 2. So we are in the legislature throughout the course of this meeting. Anything that happens here, it represents the Gauteng Provincial Legislature. Thank you. So, babaling lady, batla kra re le ko pele because re lata ka awara and re tlo shiana re tlo potlaka ka meeting wa rena. Agenda, all of you, you've got your agenda. Item 1, opening and welcome. Let me take this opportunity to welcome you all to this community meeting. We appreciate that you left everything. You came here to come and listen up. Quietly, recurrent to soka mechini ya ditoloki. Ebileng ina le tracker metšhini eo ina le tracker le ska tsamaya le yona la invite bothata bo le gole ne ina le tracker e bereka ka mo fela. So you are all welcomed. And then number 2 ke introduction. Nna ke Rebecca Digamela ke chairperson ya Health and Wellness Portfolio Committee in Gauteng. So re tlo titsibisa and then le boneng gore go tlile bo mammo ba ikilela ba kgetha ka 2019. Bona ba le ba bona mo ke bona hantši ba phelang ba tsamaya le committee mo yang ba ba seng gona mo ba tla re botsa mabaka tšatši le lengwe ba botsa setšhaba gore ko wena man.
Thank you, Chair. Dumelang batho ba Sedibeng. Le kae? Re teng. Ka lebitso ke nna Matshidiso Mfikwe, ke leloko la Committee ya Health and Wellness in the Gauteng Legislature. Ra leboha.
Dumelang badudi ba Gauteng. Le gona? Oh, lina la ka ke Mapefo Mogale Letsie, le nna ke leloko la committee e. Thank you.
Dumelang, ka lebitso ke Mpapa Kanyani, ke leloko la Committee ya Health, ke a leboga.
Okay, re a leboga. Item 3 ke the apologies. The apology of Honorable Bloom and Honorable Duplessis and the Honorable MEC of Health and Wellness in Gauteng are noted. We move now to number 4, the adoption of the agenda. As you can see, 5, 6, 7, 8, and 9. Any mover for the adoption of the agenda?
I move, Chair.
Thank you, Honorable Litie. Seconder.
Mfikwe seconds, Chair.
Thank you very much. The agenda is duly adopted. Now, please, can we listen? Are mameleng ge presentation itla and the comments, I be the comments maelana le presentation. Ge le tla ka dilo tse di sa tsamaelane le presentation, itlo ba go no re senya nako. Mara before we even go to the presentation, I think I will give the acting HOD to introduce. Sorry, I apologize. We go back to item 2. The acting HOD will introduce every official from the Gauteng Department of Health and Wellness who are here. Over to you, Mr. Malotana.
Dumelang, Chair, le batho for la committee. My name is Lesiba Malotana, ki acting HOD ya Department of Health. Ki mo table annual report ya department for the financial year 22 and 23. Chair, report ya rena ke etelle jaaka we bone. I will try and just deal with the highlights and the areas of performance and summarize the performance instead of reading the whole annual report. I hope, Chair, that will be in order. Chair, report here rena e cover the purpose, the abbreviation. Okay, Chair, ke tsamaya le senior managers from the Department of Health. On my immediate right, Kinale, Me DDG Basani Baloi, the DDG Corporate Services. Mopeli Mola, Kinale, other senior managers from the department. Chair, one by one.
Abaemelele ba bone ke setšhaba.
Go far right, Kintate Matsaneng, the responsible for district health services. Hausili Nagatai, Kintate Kobo, responsible for infrastructure. Hausiliena, Kintate Mankopani, Dr. Mankopani, responsible for hospital services. Walatela Mehawelo Malesa, the chief of staff of the MEC. Wabantate Terence Magoro, very familiar from here. He's currently acting as the chief operations officer. And then Lintate Peter Makola, who is the parliamentary liaison officer from the department. Thank you so much.
Thank you, Lisiba. You can proceed with item 5. Thank you.
No, thanks.
Sorry. Today, because we are late, things are not going well. There is also committee members that are making sure that meeting right. I apologize for not introducing all the committee coordinators of the group. Next to me, ke Nokwazingiti, ki senior committee coordinator. And then I'm also having Non-Dumiso August is also coordinator of the committee. There is also Tembim Somi, who is the administrator of the committee. They are making sure each time Renale Koreang, dilo di tsamaye ka tsela e right. There is also Dr. Mukonoto at the back, who is the researcher for the committee. And then Isaac is also present. I also Isaac Ngobo, and I also saw Israel Pagati, who is the, oh, there is Isaac. And Israel is also around too. I'm so busy ko morago ke di officers for the committee. I will introduce ba bang he re ba bona. I apologize that today things didn't go well in terms of the introductions. La ntshwarela ke re. La ntshwarela. Ya leboga. Over to you, HOD.
Ke a leboga modulasetulo, ke leboga le sebaka sa ho presenta the report. Chair, like I said, the report ke tla zama ho summarize instead of ho dila le each and every slide, as in ke just a summary, overall performance matrix ke yona ke tlo dila le yona. The abbreviations ke mantswe a fokoditsweng a explain nang di terminology tse re di berekisang ko Department of Health gore batho ba bala report ya rena mafoko a ba sa tsebeng ba kgone wa checka mo reporting ya rena. In terms of just to introduce a report here re balang mo today re table a morao wa gore o be le changes ya leadership in the province mo the premier le MEC ba ileng ba changiwa, and go changes tse di diagetseng di introduce the new priorities tse tshwanang le ka township development program, informal settlement, hostels and alike. Also, at the same time, the department in a rollout program turning the tide against the jewel in terms of just the program in Leona ya improve our Department of Health. Some of the issues reported to Dilan get a strategic overview at the time in the intervention generally introduced to the department in terms of improve. Kana ko ere bolelang ka yona ka report le clinic ya zone 17 sale ya budiwa. And then over and above that, more additional 5 other clinics said over and above. Ka summary, performance ya rena for ngwaga reportang go ona, performance ya rena increase ka 3% to remove from 51% overall to 54%, and as far as it ile ya o berekisa tšhelete ya rena ne be re allocated ke province le committee re berekisa 95.6%, and report tla bontšha gore ke mo kae mo re sa kgonang go spenda most of it ne le mo di projecteng tša infrastructure. The overall issues that re nyakang go di table ke re di summarize ka mo latelang. The areas ya concern, of course, ke di target tse re sa kgona go di fitlhella. The issues ye phitelang re warisha gape go feta mo ke issue ya neonatal mortality, bana ba ba tlhokofalang ba under 5 years le ba ba belegwang ba seng right ba na le sepsis, birth asphyxia, perinatal and other congenital diseases, and of course ntwe re warishang go feta mo as far as litigation ke re tswalla dibuka tsa rena ma mafellong a hangwa ha rena le contingent liability ya 18.2 million ke tšhelete di lawyer rang di suang department for dilo tse di sa diagalang ga bona. As far as the health system challenges, hona le slow implementation ya electronic management system, the shortage of course there was a period got transversal contract ya national monarnal shortage ya the condom, the issues ya shortage ya the mental health care beds, the neonatal beds ki one of the issues di disarefeng borong. Other issues in terms of JD affecting by berekishi or by using by the system ki the patient tsa TB tse re pallang go di tracer ka baka la o change ha di address gore go boya bona o lata treatment. The psychosocial challenges in terms of the adherence to treatment, the late presentation ya di patient tse di tlang go rena, especially bo member ba imana ba batlang go rena ba sa tsamaya di clinic ba na le di complications by the time ba tla go rena, and of course the low immunization rate ya bana ba banyane ba ba santse ba entiwe ba sa presenting themselves. Other systemic challenges ke jena le tsona ke lo tsa bo supply chain, mother and child indicators, the petlele tsa rena gore di comply ka OHS patient experiences, performance ya emergency medical service ya di ambulance le di infrastructure project tsa rena tse re sa kgonang go di deliver. Summary ya performance re bontšha mo compare last year le this other year, as I said, that our performance only increased by 3% from 51 to 54% overall. Re sa sokola ka performance ya di HAST programs, tse di including HIV, AIDS, TB, compliance and other related and other the indicators tsa bana ko dipetlele as far as maternal death and non-communicable diseases indicators ke tsone re sa sokolang go di achieve. Summary of performance ki repeater chair ki overall hore out of all the indicators the minimum targets of 80% are khona ho fitella, 26% of those targets were not met. The issue se ke boletseng ka yona ke hore inconsistent ya over underperformer more health programs ka ke tlhalositse ICT medical legal when yona di bolelang ka di lawyer the issue just finance the infrastructure. The areas still nang le significant improvements however ke mo o tshwana le o bula 2 additional clinics ya go ena daily le Lenasia South le additional 24 CHCs that were opened ka the period under review. Re continue to increase the number tsa batho ba enrollang on chronic CCMD, the chronic distribution of chronic medication, ba ba sa tleng lata di meriana ya bona go di spetlele ba latang go di multiple sites including le go di ATM. As in Twitter also re kgona we achieve the increasing number of testing for HIV, AIDS, and of course, but re sa struggle ka ba re ba testileng gore ba remain on treatment e ba challenger na le yona o tshwana le ba re struggling ka bona in terms of 90 the other 95. And ANC visits also Leona becomes an issue in terms of Babadula. And we have increased the issues about student nurses registration and cooperative halos. Other areas studied report on is performance department include that were not being able to, annual targets that were met. Issue ensuring that most of our facilities are starting to comply in terms of readiness for NHI. The ideal clinic status also increased from 94% to 97.3%. The issue about eliminating mother-to-child HIV transmission will remain on track with minimal improvement in that area. The issue about infant PCR positive 10 after 10 weeks, Leona, will be some slight improvement in that area. The issue of increasing expansion of public user for non-communicable disease, especially diabetes, hypertension, malwetse a sa feteling a le malwetse a lifestyle ke ona re increase the testing but I think as far as treatment beyond that it's something we can do. In terms of the children under 5 years in terms of vitamin A re kgonne to increase that coverage up to 64% compared to the same last year. As far as the number of deliveries that we are doing, of course, the number of deliveries that it increases at our facilities. Other areas that report on with the expansion of district health services, the issues are the severe acute one over SAC1 within 24 hours. As far as all other targets that are the patient safety incidences, those that were reported, most of them were resolved within a reasonable time, and this has to do with the complaints about happy either the clinicing or the facilities are not districting. The most of those issues were being able to resolve within a reasonable time. Let's on. Other areas that of significant improvement that were also noted: severe acute malnutrition, about under 5. We've been able to reduce that number, and it's also something that is also worrying for Provincial and Gauteng. The employee satisfaction survey improved 1.3% from 61 to 63%. Issues of availability of medicines, it's something that we also remain proud of, that we remain in terms of medicine availability, Miriana, up to 97% for the period under review. The percentage of viral medicine increased by 1.2%, and the diarrheal fatality rate also decreased. Diarrhea present the facility in Sarin. Other areas of improvement is issues that the pneumonia in a facility reduced that number, and of course also the issue that improve ICT rollout as far as bringing most facilities online as far as the health information system is concerned, and the report cover those facilities in detail. areas that remains consistently underperformance, and we just thought we should also just highlight, and the issue at the loss to follow-up declines, citizens the IRT lines that are not traceable. So we are going to test batho, we know their status, we are more treatmenting, mara aba follow up ka the subsequent treatment ki mo re nang le bothata mara taba ya o testa re na bothata mara o beya batho mo treatmenting re ba le bothata bo over maintain on treatment. The same apply le batho ba nang le TB that ba on treatment that must come back for follow up treatment re bona le challenge ya bona ba the facilities tsa rena di sana le challenges tsa comply with OHS compliance. For reasons that our facilities are old, overused, and they have been, over the time, not well maintained. The other issues about maintaining the functional clinic committees, we have a high turnover. Here I point about because our pateli stipend then tend to leave, so we call a perpetual replacement of the clinic committees. Other areas still where the sokola ka yona performer key issues here immunization of children under 1 year. There's been a drop in that area of work, and also the performance of the ambulances for priority patients. The P1 responses Leona reduces for the period report on Kayon. Areas that had declining performance area emergency medical services, patient care experiences, especially with the central hospitals. There was also area of concern. More complaining that was central hospitals, Bara, George Mokari, Steve Biko, and Charlotte McGregor. They shared that the complaints in the registry at that level of care are resolved within 25 days prescribed. And the issue about the essential medicine, or at some point, Gilead drop upon 5%. In summary, that's the performance. Over and above that, as far as our point about female, on area for senior management, re-improve target year to 47%. Our target is 49%. We are still slightly short, but we come a long way as far as appointment of the senior managers at that level. The issue of payment of invoices, we have a lot of invoices that are disputed, and because they are disputed, they affect the overall when they are disputed, but they are loaded, they affect performance here now, but suppliers got 30 days. Also, sometimes they struggle like a cash flow to service the number of invoices that are let's on. The issue of malaria case fatality rate, Leona, it's one of those, and postnatal visit after 6 weeks, Leona increase. Neonatal death it dropped like upon 1.1% for the period under review, and the maternal death also the decrease is 14.5%. Any decrease in maternal death into rate habela. This is just to summarize the areas of performance, and the details I will not get into. Chair, I'll then just summarize the financial performance here department. We were allocated for the year 20, the year under review 2021-2022, we were given 61.3 billion rand. We were able to use 95.6% of that budget, and ending up actual spending 57.049. Yeah, the total budget refilling going on. The areas study honong berekisa budget ya ona 100%. Key administration is slightly at 100%. Emergency medical services, health support services, and area ke buletseng ka yona ya more irilengly underspending ke health facilities management, more dilanga renovation and building of new hospitals and clinics. In summary, the notes it's the explain that the areas that honong berekisa chelete program irafana ka di reasons more paletsung ko berekisa that chelete up to 100% as we got to 96%. Yeah, that allocated funding. Most of our budget challenges they go to central hospitals, take it 4. In conclusion and in summary, our performance for the period under review increases at 3%, and there are areas that we will highlight already. Part of most of our priorities or elevated priorities are done in the townships in terms of infrastructure investment, occupational health and safety, infrastructure development, the program ya bana ba sekolo in the school health program. There's been also improvement in the area the long-standing area study audit in terms of the Bethele, the producing evidence for the work that we're saying for the issues here, the Auditor General. There has not been regression, more performance here and audit as explained, and the Auditor General will comment our area of work as far as that is concerned. And the issues here, the issues that the turning the tide, Leona has been internalized. Chair, from now on, the details per area of work, I don't know, Chair, if you want me to go slide by slide, but in summary, these are the details per area of work. Mara the summary, I get advice from you. Thanks so much, Chair.
Thank you very much, Acting HOD, for that presentation. I'm going to allow honorable members to make input into the annual report of Gauteng Department of Health and Wellness for 2022-2023 financial year. Honorable members, anyone who would like to make input, this is your time. Thereafter, I'll go to the stakeholder that came to also make their own comments. Any hand? Member Litsie, you are welcome. And
Kia leboga modula stulo. A ke tšee sebaka se go amogela report e re fileng ke the acting head of department, and also welcome the improvement in performance. The 3%, we should be appreciating it, but also putting an emphasis for there's still more that can be done, HOD. Particularly this improvement, I'm going to mention a few areas that are of comfort to myself as Moto Adulang in the committee. Re be re complain gore ever since re na le COVID, o ka re le shiftile focus from other programs like HAST. And when you say to us there's improvement in HIV testing, I think it's something that we appreciate, because you listened to us when you said you can't leave other things and start focusing on others. The availability of medication as well. I think community arena re tseba ga botse gore one of the things that re discourageang go ya go dipetlele tsa rena le ditleliniki gore ba re fa phanado ba re khutlisetsa morago. So when the HOD says availability of medication has been improved at 97%, if I capture that well, is something that needs to be applauded, because I think a community will be encouraged to visit our centers. The improvement on the information health system as well, I think this is underwritten by the fact that we are now preparing ourselves for NHI. And for the performance at NHI, or for it to run smoothly, I think this will be very important. And I think we appreciate this improvement, but still saying, readier than ever before. Of course, we take it with the study tour you took in China, this will help you to really improve on performance in this area. As Mekile Motswadi, the decrease in neonatal and maternal death as well, I think is applauded, because one death is just too much. And when you keep on decreasing this, it means your efforts are really focused, and we should be seeing Sichaba, especially Sarantu, but to share Modi centering Jarena. As a woman leader myself, acting HOD, there's an improvement in the appointment of females in senior management position. For us, it's a struggle, women emancipation that will forever and ever appreciate. And also acknowledging you are still behind in terms of the target itself, and we hope you'll still work on it, and in the next quarters, better than what we are receiving today. I can't really underestimate or maybe leave out to implore on yourself, HOD and the team, or as much as these expenditures and the improvement that you are reporting, can they be aligned to the targets? I think we are calling upon yourself for as levelela ka an expenditure, is one to be bonagala on the ground. Or these are the targets and this is the money that we spend and this is what we can show for the money that we have. There must be that alignment of targets and expenditure. Iskaba fela tšhelete e spendiwang, ra recorda a tick in terms of expenditure, mara re sa bone improvement on the ground. I'm also saying, le ka se tsogile le kgonne go bereka HOD, and I think I said that to the MEC in one of our meetings, appointing senior management so that there's stability at the senior management level. So that whatever we have, we know it can continue to be sustained, because the instability at senior management is not taking us anywhere. As we get used to you as acting HOD, doing work in the way that you are doing, tomorrow there will be somebody else, and it's bound to have some impact on your performance. And I'm still imploring on you to work on the stability at the senior management. Areko Hollywood, and we must stop that. I'm now going to partly speak to our communities that are gathered here. Bana besung, there are things the department can do on its own. There are things ba ba hlokang tirisano mmogo le lena as community. In all honesty, le ge re ka re ko HOD and the team, gore di patient a di tle for go tlo dia treatment, what else should they be doing? Ge rena ka bo rena re le di patient re sa kgone go tseba gore we have been tested HIV positive, re swantse ro tšea dipilisi, we have been tested TB positive, re swantse ro tšea dipilisi. It affects their performance, mara it's because rena ka bo rena a re tšea maikarabelo a maphelo a rena. So I'm calling upon you, community leaders that are here, let's know who is where, so that re ka kgona go thusana gore batho bao they must adhere to their treatment. It can't be the department forcing them to adhere to their treatment. Ge go senyega re boa gape re re department ha e bereke. That also will affect the immunization ya bana, as batswadi we know gore swantse ba risha. Go fetsa go hlaba etshwana ba go botsa gore e latelang ke ya kgwedi ya bokanakana. Why are we not taking our kids there? Re tlo lebella gape ge go hlokofala ke emergency now, everybody must run around, re imetša le di ambulance tša rena, re imetša le bona manese, because ke dilo tše nka be re di dirile to prevent the crisis that we would be having at that point in time. I think those are a few issues that I wanted to mention, Chair. Thank you very much.
Thank you very much, Honorable Litier. Honorable Mfikwe.
Thanks, Chair. Let's appreciate the presentation, Acting HOD. And as much as we'd want to applaud, Chair, the 3% increase, it does not really give comfort that we're sitting at less than 80% of our performance or achieving or reaching the targets that we have set. Health is about improving lived experiences of our communities. We do acknowledge some of the challenges as Member Lizzie is speaking about, but also we need to make sure that in the work that we do, acting HOD, we improve and impress upon lived experiences of our communities. Chair, and I see the presentation does speak about attitudes of staff in our health facilities, which continues to be a nightmare for communities. That's one. Two, the work that we need to work on. The presentation does not necessarily talk about HOD. Our relationship with the laboratories, you know, which is another critical point. I have raised it with you offline as well, but it looks like the problem continues. You know, so maybe to the portfolio committee at a particular time, a presentation could be brought as to what is our relationship with the national laboratories, including what are the turnaround times and what are the challenges that are being experienced there. We did flag as the committee, Chair, the digitization of patient records. I see it is still flagged as a challenge for the department as well, including functional work committees, clinic committees. Maybe adding on the clarion call by members to communities, that it is important for us to have functional structures in our clinics, because that way they will be assisting their department in resolving some of the challenges that our communities would be experiencing. I was looking at HOD at what are we saying about the concerns that were raised by the AG. I'm not picking them up on the presentation. In the presentation that the AG did to the committee, there were a number of areas that they raised as areas of concern. So, Chair, maybe as well, that the team could bring to the portfolio committee, how are they going to resolve some of the audit issues that are raised by the Auditor General in the work that the department is doing. Overall, concern is raised on targets that are not met, which is a problem. Maybe the fact that we are in Hollywood could contribute to us not reaching the targets that we are supposed to be reaching. But we do appreciate and acknowledge the work that has been done, including efforts by the department in satisfying some of the targets that are there. And we want to encourage that. Let us continue doing the best that we could, but know that we are a service to the community and we must give fully the service to our communities. Thank you, Chair.
Thank you. Thank you very much, Honorable Mfikwe. Honorable Kanyani.
No, I think largely issues that have been raised, they really cover me. But I think we have to also commend the department where it is due, especially looking at the targets, those who were not met, which they were able to corroborate that with reasons. And those that are met, obviously they are tangible, and then you can really see that there is really a stride from the department, from where we really know. I think there is a bit of an improvement, but I share the same sentiment with the concerns that have been raised by honorable members. And it's just to make an emphasis that the department should really take this serious, so that the next meeting, we are going to make a follow-up, and then we hope they will really double the efforts and make sure that we really reach this intended objective. Not much, Chair, and thank you very much.
Thank you very much, Honorable Kanyani. Honorable members unanimously appreciate the 3% increase that is being reported here. And Sichaba, you are also encouraged to do your part, because if you do not do your part, then some targets are not reached, not because the department is not doing something, because you stayed away or you went away, you did not report back. We really are pleading with you, Sichaba, Hore, play your part so that some of the targets that were not met because you were not there or you didn't come back, let's encourage one another as community so that we continue to visit our health facilities. Digitization is going to assist you strongly in terms of making sure that you try to reduce the litigations, because some of the litigations is because records were tampered with by naughty people who find themselves in the health facilities. And targets that were not met is also very important, that you go and check how you can improve from that 3% upwards. Thank you very much, honorable members. Setšhaba is ke nako ya lena. Ba ba nyakang go bolela le tlo emisa matsogo, and then ke le fa di number. Ge o le 1 o 1, a go ne 1.1, ne? A go ne 1.2. So if you don't raise your hand, train ifiti. Ke thoma kam. Number 1. 1. 2. Who look 2? Yes. Yeah. Come on. Number 1. Number 1, my sister. Number 1. I can come on like 2. 1, 2. Yeah, 2. Mo pele o number 2. Yeah. Number 3, number 4, number 5. Le 5 ya ke re ka mo. I want a 5.2 and 5 point something. Come on. Number 1, number 2, ya go tlase number 3. So ke 3, number 4. Ko morago. So ke 4. A ke re tlo bolela ka report e filweng mo. Re ska bolela ka se se sa bolelwa mo re ka se kgone go thusa ka selo a ke re. Rena re committee ya health and wellness. So ge le ka bolela ka other stuff, it's just for rena we will listen mara rena re nyaka o bolele ka report e tlileng mo. A ke re then re kgone go thusa department gore ye go pele. Ne ge o bolela other stuff gore go lokile mara re ka se o thibele mara I to see department le rena as committee because ge le raise the issues rena ro follow up on your behalf wa ke re ro balata re mara setšhaba sirile lena le reng mara e le ka tla re dintlo kae ko kae a go ne thuso re ka o fa re ka no refera ko ra re ba thuse mara ya ke a leboga. Number 1 o ka tswela pele re o bolela gore ko wena mangwa ko kae and then wa tlhagisa ntlha.
Dumelang kaofela. Ka lebitso ke nna Selaelo. Ke tswa ke le Zerebacom Clinic. Nka qala ka COVID. Since COVID ko Zerebacom re bone infrastructure rona e lokiswa hantle e ba right. But after COVID, things became worse. The infrastructure tsa rona di sa tlhokomelwa. O kopa hore festere lokiswe e tla nka jara kaofela hore festere lokiswe. Then ke bue hape le ka di clinic committees. Clinic committees le re a re participate, but problem e tla mo Department of Health a re tlhokomele. I recommend at all. During COVID, do you know how many clinic committees set you don't have a record. You don't have even a record how many clinic committees set you. But we were there, we were coming there at the clinic, but we were not allowed to receive injection in COVID. We had to wait for our age. And then which is totally unfair. People are recognizing any way when it comes to clinic committees. Any effort. Since COVID, how many trainings have you done for clinic committees? None. None whatsoever. None whatsoever. You keep on promising something, stipend, nothing. Nothing. But le bata di services tsa rona, le bata re lefe di report, le bata re batle batho, re rute batho batle. Batla ba encourage jwang le sena taba le rona. Batla ba encourage jwang. When you talk like me, you are targeted. Once you are more recruiting, I also employ you. It's totally wrong. It's totally wrong. Hanga ubotaro le hona eno go clinic ya rona. Batho ba keneng hona eno ha ba tsebe nix. Nix ka clinic, ka community ha ba tsebe nix. But ke di clinic committees because ha hona drive. There's no drive at all. Abana yona drive. So, kikopa department ka neti ike emise maoto. Emise maoto ka di clinic committees. Ka infrastructure tsa rona they are falling apart. DID hona eno rena le bana ba tswang ko masepala ba tlo thusang di clinic tsa rona. DID ha e patale. Bana bao ba sokola. And lebitso le lebe le senyang ba re di managers a di na taba le bona bao mara ba bereka every day ba tla mosebetsing mara Department of Health ha ba sentse ba patale bana ba iketsang ka re they are nothing ha ba ba tsebe mara ha ba batla hore ba bereke ba ba bitsa. So Department of Health le community re thuse re bereke misana mara le berekisane le rona community ha le berekisane totally. Oka bona le ka di if there's something e tshwanang le if ha ba bua ka cancer of the breast or ba promotion tsa lona towards the community di tla late motho o tla reportela hore go tlo ba le this event kaosane and how do you organize people ka le taba ya kaosane a le berekisane le rona hantle totally ke a leboha.
Thank you so much, Chairperson. Kalibitso ke Meshak Trivedi, right here in the Val, Ward 25. First, I would like to share with you, honorable members and members of the public, that I'm grateful about the MEC Nomantu Ralehoko. I think it's important that even to share certain great news, not to criticize all over again. I called the MEC almost three weeks ago, if not mistaken, because there was a shortage of medicine in a certain clinic, and at around past 11, midnight, the following day, medicine was delivered in my clinic. And it was discovered that people are not doing what they are supposed to do. They are not managing, they are not stocking, they are not ordering anything. Hence, the health manager did not see this coming, because I'm from a very poor community. So she never saw this coming, that someone will call the MEC and the following day the results will be positive. So what I'm trying to say is that at some point it's important to train, retrain, encourage our managers in different clinics, because some of them, not all of them, some of them, and very few of them, they really don't take their jobs seriously. Especially when they found that they've been deployed in an area where there is a huge illiterate among the community. They take advantage of the situation. Secondly, Kirata Hulebua, the chairperson of the Portfolio Committee of Health, Mema Palati. There was a session of this nature right in Pretoria. And one of that session was that Department of Health want to empower SMMEs, especially amongst the young people who owns businesses. Now let me come to implementation part of this. My understanding is that once a political head of the department have made conclusion, senior officials have to follow that. But the amazing part was that very senior officials begin to question the very same thing which was shared in the meeting, that public meeting. You don't know how many times our young people have struggled at the hands of very senior officials. Some of them, they are with you there in the table. Some of them, they are in different facilities. Up until I have to call Mema Paladi for intervention. And the intervention has been felt. Thank you so much, Mema Paladi. Keep up doing a good work. We really appreciate that. Now let's move on very fast as I'm about to conclude. there is a consistency in terms of doing things in a correct way. We know the history of Department of Health in Gauteng. Right now, we are talking about 95 to 96% increase. That on its own is a very good story to tell that need to be shared by people of Gauteng. And I'm keep on saying, even SABC, including some of the channels that are very much negative towards our government, particularly the Department of Health, they need to be told about this progress. From 51 to 54%, that on its own is an increase. It had to be to be celebrated. Once again, thank you so much, the Department of Health, through you, Chairperson. You are really doing a great job. But don't be surprised, as in when you add, will come once again to criticize you with facts. Thank you so much.
Hello. Oh, Angel Ndaba, Orange Farm, Ward 3. Sibonge ngale program, sibonga kakhulu, and then sibonga no MEC we health, umabizwe asabele. Siyabonga ushintsho uyalenza kakhulu ngoba noma ungambiza uyi community nje uyeza akathi ngibizwa umuntu nje akakhethi balala muntu. Siyabonga kuleyo ndawo. Ngidlule ukuthi okuningi sabangikhavile ngidlulele kakhulu entweni yama clinic committee. Ama clinic committee asemqoka ku community. Ama clinic committee yiwo awaziyo ukuthi emzini othile kunenkinga so kunokuthi gcine kutholakala idumbu ezindlini kungaziwa ukuthi labantu bayagula. Umsebenzi wama clinic committee noma ward committee siyawucela ukuthi ama clinic committee ingathi bangasenza stipend because umuntu angeka avuke eksene engadlanga ahamba yonceda umphakathi ngendaba yokuthi akanalutho. And sibabacela futhi ukuthi ba workshop labantu baphiwe certificate somewhere somehow kuzokhuphuka uthola ukuthi umuntu uba nethuba lokuthi athola umsebenzi wokuthi naye ondla abantwana bakhe because most yama clinic committee abasebenzi at all abana income. I-income leye 350 phela ya every month. So besicela ukuthi kukhushulwe. Okunye bengisacela ukuthi angazi mina I'm one person angikwazi ukuthi makufundwa ngikhona ukubhala. Bangakhona ukusenzela isummary yalento kade yenziwa ukuthi at least umuntu abe ne report yakhona mangabe kungenzeka bengithi ngisacela lokho because angikhona makufundwa ngibhale ngiyahluleka ngifuna ukumamela kahle and then after ke bese ngiyafunda. Ngiyabonga.
Siyabonga. Number 2.
Mautop Suko. Dumelang kaofela. Obua mo ke Lerato Pulo from Ward 131. I'm a Ward Committee for Health. Ke a leboga di MBC gore libe mona. Na last week ne ke le ko Banimolokwane ko clinicing. I was so disappointed. Bane ba sa tsebe gore ke tlo assessa. I was just like you kare ke patient mari ke ile ka utlwa bohloko ke thotse ile gore gona le meeting. Highly meeting manager wa teng o bitsa di official kaofela. So ke kene ke a bona everybody wa tswa mo o ya baya ko boardroom gona le meeting. So ke ba yemele staff kaofela se kene then ke lo kokota monyako gore ne ke kopa clarity gore le ka bitsa jwang batho ba sebetsang di patient di le ko officing then ke kokote ko mnyako manager a re Ke kopa o tswe hanyane ke tla o bitsetsa motho for such a long time. So I was so disappointed gore ne go na le di official tsa health di le mo gore why ba sa mo botse gore di patient go etsiwe jwang. Ha ke botsa di patient di re from 5 o'clock to 6 o'clock di le mo ka bo ma 11 12 batho ha ba so attend you. This is a challenge e ke na le yona. Ko di clinicing go bapala ka batho ke batlo buella ho mme a bua gore batho o thole gore they don't want to attend the clinicing. Ke kopa le ke le ye di clinicing le lo bona gore batho ba treatiwa jwang le rona re ja di treatment mara ha re fitla di clinicing ha re treatiwe right re tlo defaulter because of o ka se go classing ho motho o kula mara asna smile how right. Thank you.
Number 3.
Dumela, Chairperson ke a leboha. Bitso la ka ke Samuel Tshotetsi from Orange Farm. Mam MEC siyabonga. La go founela wa araba. Nna ntho ke tlolang ka yona ke safety fela ya di clinicing. Ha o bona o tsama di clinicing ho na le sewa e tswang. O go ya clinicing ho na le sewa e tlang. And then ke na le case e ke la ka e loja ngwana a hlokahetse ko bara. Bala ba thusa haholo. Le ka jeno ho thwe ntate wa Porter o nkile diphahlo tsa ngwana. Yes ga tseba ngwana mnyane ha o nkwe diphahlo tla mere di hlokomele. Ngwana wa hlokahala Porter nka diphahlo tsa ngwana ke a leboha.
Number 4.
Dumelang bagolo. Thank you so much for the opportunity. O emefana ke Lebogang Ratlala, ke tswa ke le Dobsonville, Ward 47. I hope whatever I'm going to say will make sense or make a difference. We have, there's this 24-hour services I get go to clinicing. So the challenge is one. The experience that we come across sometimes go clinicing. When you go clinicing busigo, there is no medication. They look at you and they tell you to come back tomorrow, to come and be attended to by the doctor. Is it possible not to have a doctor during those times? Or if it's an emergency, that means something must be done right there and then. If we can just have doctors, ke bua ka Itireleng Clinic e ko Dobsonville. And then, mo matsatsing, khona le ngwana na isitswe clinicing. Then the person that was attending to that child, khutile wena bolwetse ba gago ke ba motshegare ga se ba bosigo. It is assumed that when we go to the clinic, it is for us to get the doctor's note only. It is not like that. This thing can only be fixed if only if we can train and retrain. Ubuntu is what will solve the entire the challenges that we are faced with. If people, I don't know how you teach people Ubuntu, but it has to be a passion. It has to be a calling for you to be helping people. That one I'm done with. And then when it comes to the immunization, we are not that literate. We are not that much educated. So as much as the thank you. As much as the officials just for the health checks and all that, if the health department can work hand in hand with the Department of Education to say, can we please collect all the information? Because when a child is being registered, it is required that you bring along the road to health book, just to see whether the child has been receiving. Most of the time we find that bana ba admit to without such. I think that is one of the ways that you can track which children have been immunized, which children are still left behind. That might help us. Going back to Tabaya safety, Kodi clinicking, the very same clinic I went. The toilet, they are not in good order. Hygiene is bad. The toilet, the city setting, the coverilwe ka and when the basin, akuna mo tlhapa matsogo teng. Ha o tlhape matsogo. So if we can just inspect such things, we won't have to have so many queues. But ra lwala re ntse re rilo fodisiwa. Re lwatswa ke tsone di toilet tse di ntseng yalo and all that. But to cover it all, Ubuntu is what needs to be implemented wherever we serve the communities. Thank you.
Thank you. Thank you. Number 5.
Dumela. Lebitso la ka ke nna Paulina Mokoena. Ke hlaha ke tswa ko Orange Farm Ward 4 under Matot as a caregiver. My question is, I'm concerned about Bontati, about fathers. As ke utlwile ntate mola a bua ka hore bomme ba pregnant. Abatsamaye treatment ya batle ka nako clinicing hore nene ba kgone hore ba thole dintho e sa le ka nako. Ha ke re ke concern ka bontate, concern ka hore nene bontate ba thuswa jwang. Bontate ba kula ba tle clinicing, bontate ba kulela ka matlung jwale ho thwe ke dinku ha di bue. Bontate ba kula. Bontate ba ya kula, ba na le TB. Bana le blood cancer, bontate bana le cancer le bo matsweleng aba batle wa clinicing aba batle ba re bona e re se re le di caregiver re batho ba basadi never re bathetse. So ka nako ele ya maburu, I'm sorry to say that if ke hata batho di cons ho nona le di bitswang conjena gore batho ba follow upang ba shebang hore neneng batho bana a ba o etsa mosebetsi wa bona na. Ke lebetse because batho ba ngata ke tla hopola ke tla bua ba se ba nkile mantswe a ka a mangata, especially mo ke tlo buang ka hore neneng ke tlo botsa potso hore neneng implement last ha ne re tlile ho bua ka implementation e se etsa hetsi entsuwe re tseba jwang re bona jwang rona ba bang wa not educated. Es ho se implementuwe why di clinic di ditshila, why batho ba sebetsang clinicing balla, why rona di caregiver tse fatshe stipend sa rona se patalwa ke bomang, re patalwa jwang. Hona le mme a buile mona hore neng rona re le di caregiver re tla re tsoa for 6 months ke tla ke tsoa skepsel santa tim di mogodi a e fela ha bana ba mpotsa ke dula fatshe ke tinile ke ra ke le butleng le a rasa because ke stress a kana chelete ke batla hore ke thuse bana ba ka ke ya kula le nna ke kudiswa ke bontate ba sa batleng ho thusahala bomme ba kulang haholo ha rena safety re tshwara dintho ka matsoho a rona ha re kula re hlokafala re shwa rona. Clinic kapa yona implementation kapa yona government nna ke tlo thuswa jwang ke tlo bolokwa jwang. Es ke thola stipend, es ke volunteer, es ke soka ke ba le income. Ke dipotso tsa ka tseo. Then medication ho batho ba TB, batho ba TB, medication ena ya bona how to ifedile ha yo clinicing e be le eng hobaneng ene bona batho ba ba nang le TB ha ke re ba tlamehile batho ba ho bana le batho ba follow up why ba rekisa dipidisi tse a ke tsebile o mang e o potso batho ho bohloko because ba amwa dintho tsena ha bohloko ba di batla dipidisi tsena ha re ba batla re tlo ba thusa batho re khohlella rona re sena ntho tsa safety ya hore re thibeletse re sena yona ba re utlwisa bohloko because rona re batla help ya hore re ba thusa jwang ska ha batho re hlokafala re ishwa rona ba caregiver rona batho ba sebetsang tleliniking family tsa rona di thuswa jwang o salwa ha o sana motho a tlo yang ke sexually ha ona motho a tlo yang haka a tlo yang baneng ba ka ke tlo bolokwa like jwalo fela je ho fedile ka nna ho ke hlonolo ke hlokafetse ke thusitse nna ho sharp ho right ke tsona potso tsa ka tse ke ne ke botsa mabapi le ho implementa le hore nene ditleliniking ho shota batho hona no ho shota batho haholo ho a meeting ba ya meeting aba meeting rona re setse di caregiver ha ba ya meeting di stakeholders kapa bona bana ba baholo di manese ba ya meeting ha ba ya meeting re a dula re setse mona mphakathi community e kulang e botsa rona ba re chike khathi mona clinicing why in le meeting ho bo shapa 2 o'clock lunch kena ka 10 o'clock up to 2 o'clock ha re soka re thuswa ha re soka re etswa next re arabe re reng rona re arabe jwang Oba ki dutse jalo ka patient le nna ke tlisitse patient ke tsamaisa ke ipusha ka wheelchair ha ona di wheelchair ke robele le tsona je ke wheelchair e leng ya robaya e dutse patient ke thusa hala jwang ha re thola lunch re ja lunch mo le nditshila ho ditshila di clinicing ho ditshila di clinicing ke di toilet ke kantle di dustbining ho pakelane dithuto tsa dikorokoro maphela kwane a tletse a mangata but implementation yona e teng ne kopa ho botsa potso tseo tsa ka kopa tshwarelo
Thank you Paulina re aka citing Isaac number 1 ka mo ke le boditse hore a gone 1.1 or 2.2 le 5.5 akere ke ebile ke 4 ka
Sanibonani o jame lapha lo ngusara wakwaJiyana ongumama Mahlangu eBrongospruit ku 103 and 105 emaplazini le bengicela ukubuza ngesikhathi besizile la lo khanyana seza sanibonga ukuthi siyathokoza ukuthi ngoba sanicela ukuthi abantwana bethu basilalelile benza ugrade 12 basiqede isikolo then emva kwalokho nenza ukuthi abantwana abantwana babe bese nenza ukuthi babe ma assistant teacher at least babe khona esikolweni apha baphithizele bajabule kanye nabanye abantwana babone bafuna ukufana nabo ukuthi bakwazi uqeda isikolo then eseleke kuye kwamangaza ke kileso stipend ebekade nibathembise sona asisezi bakithi solo kobangenileko ngoFebruary until now baye babanikela ngathi ngo April kwagcina lapha until now unyaka uyaphela seba abantwana basebangene kwamachonisa abantu then thina bazali ngithe sisala kwamachonisa ngoba abantwana bafuna uba clean lesikolweni bafuna ukugcoka ngendlela eright then akukhonakali ni uthi afike ekhaya uzaselenza isikolodo kwamachonisa ukuthi ubone umngane akhe agcoka irogo elinjani ofa agcobise ngeperfume enjani okubonisa ukuthi ufuna ukuba umuntu ongcono naye imali ayikho then athi haye kupheleni baloko batshelwa ngomvulo nge-15 bangenile na ku WhatsApp iWhatsApp noma neFacebook uprincipal wabaphendula wathi le ndaba sisagijima nayo sizakubuya kini even namapatrola awakahabuhola manje siyacela sizoni phendula manje njalo nje kuthiwa nge-15 namanje abakaholi balinde i-15 lezi ezizako zakusasa bantu benkosi sicela nithembeke asebelieve nasele
ima kancane mara le a rasa man gape le a rasa kere na re mo utlwisara because lena le a rasa ene o tla ka information e important manje lena le a rasa le a phaphatha rena re mo utlwi please a re feng mamsara chance le ena a bolele sa nyakang o se bolela re mo utlwe gore re kgone go thusa mo re kgonang lena le tlepa le a rasa rena ya a se ka mokgwa o tshwanetse re rane meeting kgale le sa rase ba bang ba bolela nna tšeane o nyako bolela lena le a rasa re mo utlwe rena re tlo no re o boletse okay go lokile a re nyake gore re tsamaye mo re sa utlwa gore tshwara o reng please can re mamele re be le order ne ya mama Sara tswela pele o bolele mama
siyathokoza
ba rasa ke ntho ene ke ro emenya
Ngikhokho ke bakwethu engithanda ukuthi sikutsho ngithi ukuthi namanje nje basathenjiswe i15 ene abanye sezeze bachiyile abasakhulumi nokukhuluma ni ngoba bathi balile angithi bachiye emakhaya apha sinezizukulu banabantwana baba nabantwana basesikolweni then bachiya abantwana baya balilela njalo manje bayachiya ke ngoba nyana kusasa uyazi ukuthi kusasa uzokwembatha ini ezabe ingasiyo kade imbethe izolo manje sibantu benkosi besicela ukuthi lo muntu enimnikezileko ngoba somewhere kuthiwe basho iproject enikelwe umuntu othile okunguye obhadela laba abantwana owathatha iproject ngalaba abantwana ukuthi yena uzababhadela namnikela isidudla semali zize mahememe eswezwako lawo ngoba sesehla siyanyuka taswayi sibuyela kini eseza kini sazokuthokoza ukuthi niphe abantwana bethu umsebenzi ukuthi bangaloko bajame etolo babe bobaba bakusasa nama president akusasa ngoba sikhulile nje siyadlula bathandekako manje sike okhunyeke esidlulela ke sicela nisizeke kuloko bantu benkosi akhe lo okhulumileko ke nimphusha ukuthi lezi 15 zangelesithathu definitely abhadela abantwana bokusukela enyangeni akhanga babhadele ngayo bakwazi ukuthola imali abo bangatshelwa ngoDisemba bathandekako ngoba nempahla zabantwana ziyaphela esitolo impahla ezihle ngiyathokoza ke ngendaba abantwana ngicela ukungena endabeni yaba traditional healers ama traditional healers siyabawa ukuthi ngoba ke kwaba isikhatshanyana esidluleko lesi ke kwaba nokwethuselanyana okuthile ukuthi basho iparlamente iza kwehla sibe sema meeting in iparlamente iza kwehla izokuvala indumba zethu then bachiye basho bakhiyile endumbeni siyanicela abantu benkosi le akusiyo sisipho esingaphakathi kwengazi zethu angeke uvala indumba leya ngoba ngikhuluma nawe nje kukhona ngizukhomba indawo ukuthi kuphi ukhona oye wathatha indawo lazomunye ugogo wayozichisa wathi bashuya umntwana lo badlala ngaye usindisiwe loyo waphelelwa umsebenzi kwaqala kwachimoto wakhe yena self wasuka bamthatha bamusakezi kudeke manje inyanga kanti kade akhuluma ngenyanga kabuhlungu yebo khona siyezwa kuma radio ukuthi zikhona ezingasizo zeqiniso eziphethe izitho nezithatha izitho so labo bona bathandekako ngiyacela ukuthi niba solve ngendlela ningasolva ngayo but hayi sithuselwe ukuthi nasingana certificate njengoba nyana sithwasele sasikhathi certificate besikuphi kodwa umsebenzi nabantu bapholile enaceda lapho nasithembisa ukuthi sifanele sisebenzisane nama clinic siyazama ukusebenzisana nama clinic bese beze basitshela ukuthi bazokuza bazostraina ngamagulo la abakhona bona basemakliniki nalaba abo-doctor ngithi bayafunda right through nakungena lokhu bayafunda nakungena lokhu bayafunda then thina soloko loko sitrainelwa yila bantu abasinikeleko umsebenzi ukuthi kuzokuza umuntu oso then udile ngaye kanje phelela lapha mara nase lafika lapha aphethwe ngilokhu kugula lokho okunye lokho okuthiwa abasinikele wona amaphepha ukuthi simtransfere eclinic manje nangingakafundiseki ngokuthi bona nje sitshelwe nge-AIDS nge-HIV kuphela i-HIV seyidlule sekusikhathi mara sekukunengi okube khona and every time sitshelwa ngokuthi bayeza bazokwenza i-training like nabantu basemakliniki ama-clinic committee njengoba ubaba lo akadasisho athi ama-clinic committee badlala ngathi unithi sele nifikile kuthiwa uyeza ubani uzonitraina for ukuba ama-clinic committee senifikile khona abanitshela bathi hayi iprosponiwe uchairperson iprosponile because of uyakhamba uye unefundo ayozenza ufuna meeting ayozenza nize ngemali la elokazini nizitshela ukuthi sesingenileke sizokubamba leyo 3 years bese kungena abanye njalo siphuma lapho sicela ukuthi nale nibe seniyasinikeza netificate njengobanyana njengama training la anandra senziwa wabantwana bona la bese esikhuluma ngabo itificate esichoko bona nje sibe mapatrola saba ma policing forum kodwa sathenjisa ukuthi then asikeda lapho sizakuthola itificate owe azange ziphume kodwa abanye bakezinye indawo sibabone baziphethe itificate ezo nama name tag wabo kodwa ke leke yethu le indawo kwatholakala ukuthi umphathi wethu akayingeni leyo asizitholi lezo not certificate what something ezokusho ukuthi wakhe waba into enje ngoba iyafuneka ikhuphulela kwenye indawo ene iyagcugcuzela nabanye nangisakhuluma ngabantwana besikolo laba nabangaholiko nje laba nabaqedako ngoJanuary laba ngeke basavuma bazokuthi akuholwa lapha manje akube nesibonelo akube nento eyenzakalako eqhubekela phambili bomama siyabonga sicela ukuthi yazi especially besibawa ukuthi kusetolo wherever kube nama-inspector njengobanyana nasemakliniki akhe kube nama-inspector and ama-inspector wakudala lapha lawa abobabukhomo nasezikolweni benibona nje kuthiwa nangu-inspector imoto ima ngaphandle u-inspector ufikile abothishere nangabe batshelwa izolo then nangabe batshelwa izolo nigijinyisa ilanga lelo kuyakunyagwa kwenziwani ekuseni nimfunyana nangusewula ake kube nama-inspector lezi zinto ezikhulumekayo zibe nizifumane live zisenzeka nihlale lapha kade khona omnye usister bephele ahlale khona lapha ngathi uze ekliniki kanti uze asuka la ePitori manje asamboni
Number 2.
Tobela. GS Kukuno. Kele tamisha. Kamo kakabophara. Ke gopela gore ga botse ke tlo ile ba ntšhamola gola wa ditšhalete. Ke tsamaya ka tsona. Ke botsisha gore no ka kwa ditšhalete nka kwa solanka le ba maphelo. Ka mo gare ga ditleliniki tša gona le tše nnyane ke bolela ka dirumana tša gona di sa kgone go afforda se sa kgone gore batho ba ka kgona go thušega ka pela le kgona gore godimo ga budget ewe le e hlalošang gore le ka ga dikamoranyana tše pedi tše tharo gore batho ba thušege na ke ya mathomo eo according clinic committee bagolo baka gona le ntwe ngwe sontse re thušaneng ka ge re tlile mo re tlo thušana gore le lena le kgone go kry-a dikoulu le achieve le kry-a dikoulu ka mo pele ba dula setulo le bona ba go bereka governmente especially le bona bawe shumashana le setšhaba jwale ka rena gore batho ba ska go attenda go tšea dihlare tša bona le sa gopola ke itse ka e hlaloša gape e a lomela eo ge if nako nngwe bona ba digrupana ene ba dira bjalo ka bane ba tla go rena ba reporta batho ba ka taba gore ba bolela gore no ba swere ke malwetši a mabjang a ke tsebe gore le itse la fetša le tšea bjang le monitor goba lena ka bo lena le ya ka kua le lo hlola kliniki tše tša lena ka gobane ya lomela samare sa mafu ene motho a ka se kgone a go ya ka kua a ilo go te thuša ka ge ba bolela ba rone AIDS example re ska e tšhabela dilo tša mogutong gore re berekišaneng e swantse re ebe ka nnete re bontšhe gore ra berekišana dilo tše dingwe le tše dingwe re di bolelang re thušaneng ka nnete gore bao ba boletšene tšona tšeo ba kgone gore ba ba ahlole ka baka la gore a gone motho a swanetšeng gore no a ka bolela sephiri sa motho e le ge le doctor a ke nagane gore swantse gore a ke tsena ka kua ba re ke swere ke thipi gore ke bolwetši ba sukiri e swantse gore a tsamaya gaša poleleo e tšwang ka mo go nna a ke nyako senya nako bagolo baka ka bane kgomi a ka mo ga sekhukhune a e ntšhe boloko ka moka a e ka bontšha ya hwa
Mrena Sekhukhune bohlomphego o re go nyakega space ko tleliniking ke tleliniki ya ko kae
ka mo Brongoro ka re Thabiseng mokutwana a mene location a gona ke re Thabiseng ka re Thabiseng ga o se le bo Sethobe le bo Brongoro
tanki ra leboga mhlomphegi
ke a le leboga
ba 3
Sanibonani. Lo khuluma yo Vincent Mulefe from Ward 135, Proteas Lane. Issue ye clinic is still a problem. See accommodate to extension 11, which is a very small clinic, and the population yalapha ining. The next clinic is at extension 11. It's Izibrecom, which nayo in a shortage. Yama nurses. Okay. Point number 2 ngize ku issue ye report in terms of not before the report. Ngize ku issue clinical committees. I think Sileka is safety in terms of ama house visit. Because now lately khona abantu abazibiza ama clinical committee bavakashela umphakathi and they start kuba ropa bathi bazochecka abantu abagulayo ezindlini. So it's a problem kuma community in terms of safety. Can we have ama safety measures aswa apply ukuthi whoever yenza ama house visit akhona ukuzi identify ngendlela right mhlambe bakhaphe ama vehicle we health emakiwe so that kungabi ne problem ema community. And then in terms of to reference ku report Mr. Lisiba aqeda ukuyithebula 3% in terms of how far ni fikile, it should have been into 5. Kuya ngalendlela ni hambisa ngayo, at least 5 was acceptable. Masibheka ama suppliers ukuthi awabhatalwa on time, nayo aletha inkinga ku health department, and a lack of rotation of suppliers nayo is iba ne problem ukuthi one supplier ithola business senkhulumela in terms of black businesses supplier A1 iyo ethola business ku Department of Health, and nakhona kune problem yama fake quotations figure as if aphuma ku Department of Health, and uthola ukuthi mawuchayilandela quotation yakhona ayiphumi ku Department of Health. It's within a scheme sangaphakathi nje baphana ama business board, and then naleyo iletha problem gu helping out i department ukuthi kube ne speedy service in terms of supply service. And then size ku ma clinics Guma clinics. Okay, lay ama suppliers. I think we need to attend it strict measures. Hence, NHI will be coming in, and from the last meeting, it was understood that Guti suppliers needs to take part to Guleyo NHI budget. And then, Guma clinics. The problem is now Guma clinics again, just to be short. 3 clinics that I can mention, eHillPro, equals, okay, 2. Yeah, eHillPro and equals le NX2 para. There's always shortage of doctors. HillPro clinic is always having student doctors, which I don't know, Guti, not to undermine them, but I don't know, Guti, Mabafige clinic bayatuga. Various cases ezenzakele, abantu besimame bamiskera ema-toilet, and considering the fact ukuthi ama-toilet awakhona angcolile, I think there was 4 or 5 cases ezinjalo. And then equals nayo mawuya khona bazakutshela ukuthi you are in a wrong zone, bakurefere kwenye clinic, which is a problem. Ngalesikhathi uletha umuntu uyagula esibhedlele, and then bakuthumela kwa another clinic, nakhona kune shortage of doctors. And increase, to reference again, go report, increase yama ambulance services. Can we please increase our ambulance services? Because a problem go to your phone, ufuni ambulance during the night, nangu muntu pategile, autoli ambulance. Ambulances as after 6 hours, you've just made a call. So kuba ne problem enjalo muntu agcine ashort. Nakhona, I think it has to do name, I don't know how they coordinate it, guthi ba supplier kanjani or ba enza kanjani. And then sibe ne problem again ya wona ama clinical committees. Clinical committees kuyalwiwe ema clinic ema community kulwelwa ukuthi advertise lack of advertisement ukuthi people must partake kuba ama clinical committees bafakana ngekibo, so you know ukuthi mhlambe uyichomi cancel uzalanda abantu kuleyo zone abafaki and afaka abantu abangana knowledge abangana nesineko sokusebenzisa nomphakathi, and it becomes a problem. And then staff, ama nurses, please guys, njengoba uMamsara shulu ukuthi ungathi kungaba nama inspectors. Yes, it's true. Abantu laba basiphelela inhliziyo, abasinaki bahlala baphuza itiye bawuthamela ilanga ema clinic. In the previous meeting ngengacela ukuthi can we please nivakashele iward 20 eBara, because angazi ukuthi ngathi ukuchitha umchamo phansi or kwenzakalani, and that's an admission ward, so it's not healthy at all. Ama health hazards awekho right. Ngiyabonga.
Thank you, Mulife. Can we have number 4 at the back there? Yeah, ubaba, uput.
Sanibonani. Uthemba lo uphuma eDriziki. Uchoidi no sisidi lapho nekopa fela ubotsa ka problem e kena le yona. Ka mo Driziki mo re dulang teng ha ona any health services e leng ya operate ka mo. The nearest clinic go extension 7 whereby it takes someone to take a cab just from Wadulanting where more. That means it's more than 5 kilometers, to put it in your language. And now, secondly, we don't have the robots. The most shocking part, Leon Extension 7 clinic, I ain't even listened to manage. And you are covering something like 1 year, 6 months now. Who's now a manager at that clinic? So as a portfolio committee under health, this is my plea. Why is it so difficult for Lona as portfolio, as the 7th Zarona, le create mosebetsi for bana ba lona? When I talk about mosebetsi, rona re rana di NPOs. We have to rely on USAID, Otola funding, South African TLT. HOD, We have to go private sector, re lo batla funding, South African still teng. And then listening to the gentleman, Anabuakade increase. He said, last year it was more, they used 93% or 93% if I'm right, and the rest was taken back. Why shelter government in the hotel government? Who are the NPOs as a funding? Karamagechine Aruna. Why shelter government in the hotel Morao? Renali the NPO. Tell us about the approval loan, SD70 Aruna, the tole funding. The NPO saying that had the tole funding, but about holy. The robots, they did not work in our community. Y'all tell before you get lower. Portfolio committee, can you please stop this thing? You're to encourage our bara high here. You will never get anybody go bara. I'm sure it's only about 2 or 3, but on Kara Orange Farm, bar. The rest of bara here about to go so wait to the nearest community. But when it comes to our local clinics, some more Orange Farm, but what's better more but also wait to the bone. We don't have people within our area, but the facilities the building. Why are you always hiring people from outside but also service and thing? Come on, little bear, I look at the next thing little bear tomorrow. Voting station, but really vote. Can I school and so check all the teachers? Can I clinic in your check all the nurses? As about modulante. That's why I can a high number about HIV and AIDS. Up to about 95. That number will never reach. Because the only number on Leon, Kyotolam from the clinic, that means to the places whereby only service along data hall. In my community, go to Rizika clinic, I'm talking service, I'm talking state. You cannot tell me how many people ban HIV in Otabolishano. Neginali MEC by March, in the Rosta program at TB, Limenoman. She only found one person. At least one department door TB. When we brought everybody, more than 25, but one TB. The reason health is not in that department in our community. Why Parliament takes it twice in order to get your services? As portfolio committee, who are here to listen to us? Let's young the clinic how each and every community. About the mobile clinics and the service. Last question. I work with you guys. I know Galna Dinese. Stop telling us who is the staff. The necessary but South Africans. Everybody matulem sebeti. Harina Dinese di clinic. That Renal mobile clinic. It's a maganese iwan. Hanese living. Mobile clinic had about too much bashwa. Renal 3 months is again a community owner because the nurse was not there. Has one to living wala kula zangata for 3 months. When you go to Tatamatole, when you go to MEC, I will count everybody as person alone. What is happening? Department ali ribatu, mama, bisura kitemba. Kirwana kina organization kaman kina about 46. Ba volunteer kina more than 5 years operate. Nzanga ngola business plan akatule funding. And the worst part in our community, hawana any health clinic. Yo katela. Status self sona mono has silence and need. Stop lying to the South African. The number that you say, Etropil, Epahame, HIV, TB, cancer, everything you can name them, has a need because we have people who are not in your database. Bayakula, Halio Ubona, bring services to the people. Halikata, Hiramba to Balikation, Skilata Honakalabrao, Lebate event, Lebatale Hall. Ocho Lata Sebetumus. Hence, Lunal Toetimo. You came to us, Rilimona, you must be worried to Batoa Basim Sebeti. Anything in Sarona, Banabalona from so to Baspetamon. Otherwise, you can just alone your staff and go to the hall. I got that, Mona. About a little Tuesday.
Number 4.1. Hey, Isaac, if I, no, 4.1. Bafelele, ki 4.1, oh, yes. I will see more ki 4.1.
Dumela, libiso la ka nna ke Mami Molebati. Ke rata ho leboha batho bana ba buile. Now I'm one of EPWPs under Department of Health. So nna ke batla ho tseba ho portfolio committee hore hantle health department e hira ka mogojwana di districting tsa rona. Ke launching ona tjena na ke sebetsa mo clinicing ena. Re na le cleaner A1 e permanent. Since bana ba le 2 and ke clinic enkang section ekang Solen Park, Valdrift, Duncanville, Bedford Park, Central Vreneghe and Unitas Park. So since me a ileng pension, we ile ka 2021. How so replace with cleaner? Re na le di apartment tse 4. Ke cleaner A1, then re 3 SEPWPs. Ke le ka thaba hampe ha ke utlwa ka nka lunch ka re ke batla ho tlo botsa ka jeko lena. Hobane ke tswa di interview tse 4 hona ntwe ke sa itsebeng ka cleaning. Ke kopa le kena ka ra di district ha holo ya Sedibeng. Go utlwa bohloko ha ona le di post ho te re apply SMEC a itse re apply le ntate le Sufi. Mara batho bana ba hira bana ba bona. Sedibeng batswadi di nurse di nka bana ba bona ba kenwa ka ra EPWP. In 4 months time ba tseba hore ho tlo ba le di post tsa cleaning tsa di data tsa di eng ba hirua ho tloa mo ba ba isa di clinic tse ding kapa dipetlele. Ho bapalwa ka rona. Ha ona mhlang health e tlo lokang because nna ke tseba cleaning ba batla ke rute motho. Ho bothwe di clinic di fail, ho bothwe stats ha se balance. Ke kopa please ho tloa ka jeko lenana. Ke kene ke na le 41 years ka ra EPWP ke na le 50 years. Ke tswa di interview tse 4. Ha ona ntwe ke sa itsebeng clinic ya ka dula e thotse di 100% because of assessment. So ra kopa hle re kopa le kena ka ra Sedibeng ke le shebe system ya bona ya ho hirua because hona tjena na who create all about di post ha re botsa di post la nna tswatswaneng di interview di bile neneng ba re blela ka Nancy Spane re a kopa
direla favor wa repeat re utlwile a ke re ke tlo le araba tse ke tlo le arabang okay o ska pheta wa pheta
ke phitiswa ke pelo bohloko mme wa ka.
Okay, ifa number 4.2. Ko siteng yela 4.2. Wa di last.
Dumelang.
Ahe.
Ka lebitso ke Lerato from Ward 35 Soweto. Concern ya ka E1. Issue ya di clinic committees. All the time, ha re na le di meetings, we ke member ya clinic committee ya ko Jabavu. All the time when we are ko di meeting, re dula re bua ka taba ya stipend. Ke a kopa hore we should go back to people and tell people the truth hore clinic committees ha di na budget because clinic committees ke governance. I only find out that this year hore clinic committees how na budget e allocated for clinic committees. So ne ke kopa hore ha le mo modimo go back to the people, inform people batho ba ska ntse ba bua ka stipend and le tsela ho advertisewang di post tsa bu clinic committee ha correct because of etsahala incorrect a ke batlo le ho tshore in what way but ha etsale hantle. And then my concern as clinic committees, the clinic tsa masipala ha di thole medication enough. When ops manager e romela order ya medication, ho khutluwa ho thuwa Panado ayo, ha ona eng. That's why community end up ere the clinic ha di fane ka medication. It's because medication it's not enough. And the second one ke kopa
Lerato
mme
number 1 no sa emisa letsogo number 2 o boletse ka stipend ene ba ba emisitse matsogo ba boletse ka stipend already sa di clinic committee 2 o boletse ka di adverts ba ba shetseng ba boletse before wena ba boletse ka di advert hore a di tsamaye sharp 3 less medication ko di clinicing they've already mentioned it so who fa chance wena o repeata se
finish can I finish
akere tshwanetse nna ke be fair because ngaro ko fa chance wa repeata ba ba emisitse matsogo they were 4
me ana bua ka issue ya education far from health. You gave her time. So plenty time.
Lerato, ki file everybody chance ya hore ba emise matsogo. Everybody o emisitse letsogo. Ba emisitse matsogo ke ba file chance. A wa Lerato a re bereke byalo. Re emis rile matsogo ka mo go emisa 2 ka re matsogo ka mo go emisa 5 ka re matsogo ka mo go emisa 4 a o nyaka o senya meeting wa rena wena ke re Lerato re emisa matsogo ke file batho chance now he ke re bolelang le repeater batho ba 4 ba ba boletseng re bereke bjalo Lerato setšhaba ke nyako tšea nako e ke le leboge gore le raisitse di question. Number 1, portfolio committee ke overseer ya Department of Health. Portfolio committee ga e involved ka any implementation ya di program mo Department of Health. Rena ba accounta to rena. So let's cover any expectation gore rena re le committee re tla re ba hire members ka hira mang ha re involved mo rena as committee a se mmereko wa rena gore re appointang NGO or le sky appoint a se mmereko wa committee rena mmereko wa rena ke public participation re tlisitse mo today gore le botsise department di question rena as committee a rene mo re tlo le thusang ge ba sa o thusi o tla mo wa rena ke nna le problem 1 2 3 professionally officially re tla ngwala lengwalo re o thuse gore ba o thuse a ke re mmereko wa rena ke ela mola e ngwadile a ke re ge re tla ho lena re na le mandate a re no tsoga ra re ikutlwa o ka re kaya no re a circulate all over and mo meeting re fa batho chance gore emisa batsogo ba lenyoko bolelang batho ba emisa so ge ke extend ka the other 2 then ke phoso gore re next time re tlo no re 1 ba ba emisitseng ka nako ela go lokile because lena le a repeat and a ke sure no representation go na le mo ne bolela ka di NGO that were not paid. No. Presentation ha ya bolela le ka gore di stipend tsa di clinic committee there was nothing like that. Ke le fa chance lena gore le di raise rena ge re tloga mo re go checka le bona gore next time he re tlisa public participation ba tlhalose gore e bereka so mara le ska re kgante a re bone gore go diragala eng ba bang ge le bolela fast a re lutlu and re ka se thuse ka selo so ha re involved ka di appointment ka anything we tlisitse public participation gore le botsise department mo meeting so a ra le kwatela mara ke re ra thusana ka go ya pele ne re ka se tswile re le kwatetse rena Ar mamelaneng to the Department of Health in Gauteng. In-service training is very important and is needed by the staff in your health facilities so that the skills continuously improve. There is also a shortage which is problematic. Shortage ya ditlhare, shortage ya staff ko di clinicing. You must go and please improve on that. Staff attitude is undesirable because sidira hore community ibe unhappy with the services that you are giving. Safety is very important in our clinics. I know molefe o rile maybe go be le di marking tse di itseng magodu molefe lona tlhalefile ba tsamaya ba ya go create di markings tsa o imitate Department of Health and then ba tlo senya ko community so mara point e we raising is important because safety ya di ba dirang di home visit is not guaranteed le bona ha ba safe at the same time community le yona ha is safe maybe the Department of Health will come ka a plan e tla make sure gore ba protect community at the same time ba protect the workers, the employees that are doing a home visit. Go tlhokahala perhaps Department of Health and Department of Community Safety ba come together and come up with a plan on how to address some of these issues So safety is very important. Akere we know hore magodu ba a step ahead. Ba ropa ko di clinicing, ba tsena ba bolaile a doctor some a year or two ago ko Soweto. And that in a private clinic. That can also happen even in our clinics akere. So and then omong boletse ka road to health is compulsory hore ge ngwana ya sekolong a produce road to health card, because akere tla be a tlhabile di immunization and then ha risky go bana ba bang aka se tlo ba tshela ka malwetse akere. That is very, very important. And then on DID, but the toilet is dysfunctional. Mr. Kobo umo tshwanetse a make sure gore the clinic the toilet ko di clinicing di a bereka, and a hunya ke hore di clinici di be le di toilets that are dysfunctional. So Mr. Kobo, in the next 3 months when we meet, you must tell us gore are the clinics, the toilets, all the toilets and the basins in the clinics, are they functioning? There is also issue ya di chila. Ba re ko clinicing e nngwe go na le only one cleaner. Eo e tla araba ke leadership e leng mo ya Department of Health, because a re nyake di clinici di dule di se school, because tshwanetse go nne go le clean ko di clinicing. So in terms of those things, ke nahana hore from us as a committee seated here, some of these things, the ambulance, they are ropiwa ke di ambulance, you know. Ge ambulance ko prongoro spray or ge ya ko refilwe ba itshwere po, and you know hore ditsotsi di bia le di spikes ko tseleng. Ge clinic ge ambulance e tsamaya e gata di spikes, and then ba ropa ambulance ba rope di dilo tse di leng ka mo ambulanceng. Ke mo e leng hore community as setšhaba re tshwanetse re eme ka maoto. E ka se be mmereko wa Department of Health alone. Tshwanetse re o bolela le di kgosi le dindona gore how are we going to solve this problem. Me o mongwe o boletse mo ka bo mme bontate ba ba sa ing check up, ke dumelana le ena. Bontate motho o na le headache today, o nwa ba re keng grandpa, e boya hape tomorrow o nwa grandpa, e boya hape after 2 days o nwa grandpa, e boya hape after another 2 days o nwa grandpa. You are not doing yourself a favor there. Once you ulwala, you cannot today nyana maybe stressed ki something. Mara you can't continuously unwe grandpa mwela ile hore a o tsebe hore bothata ke eng. Ene bontate le eng check up please bontate, le ba di professional ba e check up bontate, le ba ba na le di medical aid ba postpone go ya check up. Then ge ba lwala ba tlhokofala ka speed, because khale motho a sa e check up or a dula go na le bolwetse, the next thing ba re mme o moloi. A ke re ke wrong, bomme ba modimo ba re ke ba loi, mara go ka ya clinicing go tletse bomme a kere why bontate ba se go ko clinicing. Mme o a bolela mola gore ba na le cancer ya letswele, na pile ko hae ba re mosadi ola o moloile gape o ampur pension, mosadi ola o nyoko o ja di tšhelete tsa di pension. Le ka mo go tshwanetse le go checka ba checke cancer. Ke re ja dilo tse dintsi mo a re sa ja go tshwana le kgale, malwetse ke a mantsi. Yang bontate le go checka ko clinicing, ba checke di cancer, ba checke le prostate cancer, le tla phela. Bomme ke ba bantsi mo South Africa go feta bontate. Why? A ke re bontate bomme ge a lwala ka speed o kitimela clinicing ka nako ba mo checke, then ba mo refer to Bara or Steve Biko, then me a create thuso ka speed. Bomme ba banga ba na matswele because ba discover le cancer, and then ba tshwanela gore ba tlose letswele gore mme a phele akere. Mara bontate yo ba nna gae go tla loka go fitlhela ka di last minute ga a fitlha kwa ba re okay it's too late, mme etla mme wa modimo ga a fitlha ba mmotsa gore go shetse nako e nyane, then family iba unhappy. Mara bophelo modimo file o mollo mo bophelo ba a re di clinicing from now henceforth bontate a re di clinicing re check up. Ke tlo hand over to Department of Health gore ba responded to the issues, and thank you me for raise a issue e ya gore bontate a ba di clinicing. Mono o as mono o wa ha le one ke mono wa rena di health worker gore bontate ba tla lata di clinicing mola go senyegile, go ra gore ke nako gore NHI e bereke all over so that le taba ela ya di-distance tsa go ya ditleliniking e hafole ge a kere Department of Health acting HOD Mr. Malotani, you can respond.
No, ke a leboha, modulasetulo. Ke tla kgopela ntate Khobo le ntate Magoro ba thome ka ho offer the response to some of the question. Then the DDG will tla respond and then ke tla ya mafello. Ke a leboha.
Thank you. As I was listening to the questions, the chairperson already summarized for me. I was making notes for everyone. The toilets being dirty, of course, that will be then operational, need to be cleaned. The toilets not working and also washing basins not working. We will look at that. We'll give feedback in 3 months' time. One thing I can ask from the public, though, is that all of our hospitals and clinics, there seems to be people interested in taking our taps and they're disappearing. I've got even pictures as far away as Tembisa. We need to look after our property, because if we replace the tap today and tomorrow they are gone, and then after 3 days you definitely will not have a basin to wash on. But we will continue to do what we have to do. Thank you.
Thank you very much, HOD Sichava Dumelang. We have spoken a lot about the clinic committee's chair, although it's slightly, outside of our scope. But Sichava sa rona se a tseba hore mo Gauteng re na le di-clinic tse fetang 373 akere. So ke di-clinic tse malo. So in these clinics, engwe le engwe ya yona e tshwantse e be le clinic committees, committee members. But ha re lebella ho tsona kaofela, re kreya hore tse dintsi tsa hona a dina di-member tse fitlang 5, ora hore di-committee tsa rona a di-functional akere. And re a tseba hore ntho e irwa ke eng, e irwa ke hore batho ba rona, they are using their time hore ba ye ba yo ba di-member tsa di-committee. As the department, a re so kgone o kreya tsela ya hore re ba patele le ona taba eo e ira hore functionality is ka ba hantle. So re a se utlwisisa sello sa lona sa hore le nyaka o patele, but fela ke process e department e tshwantse e lebelele. National policy ona jwale e guidang di-clinic committees ke policy e sa boleleng fela ka Gauteng, but e kentsha di province kaofela. So it's a balancing act a province e irang ona jwale. Le a tseba hore even in the past there's been the promises tse bileng hona tsa hore ho tla ba le matsapa a hore batho ba pateliwe akere. So hona jwale a ke le tshepise hore the clinic committee members di tlo patelwa, but fela ke bolela hore ho na le process e thomilweng e department e irang hore re kgone ho lokisa taba eo. The problems kaofela tsena tse le di buletseng re a di utlwisisa, but fela karabo ya hona ke hore ho be le stipend. Ha re ka se be le stipend, re tlo tswela pele re ba le mathata ana. Taba ya o appointa ya hore o appointwa bo mang, batho ba tsentsha batho ba bona, le tla hopola hape hore advertisement ha etswa e buletse ka hore re nyaka motho ona le experience le leadership in the community akere. Ya bolela hape ka hore o tshwantse ba o tsiba hanyane ka taba ya health akere in the area, but more importantly ne e bolela hape ka taba ya matric. So all those key issues play a role. Although ha re fitla ko matric re bile le tsela ya hore we can put a waiver ra lebella tse dingwe ra tlosa matric, but hona le dilo tsona tseo kaofela. But re le utlwile mo le suspectang hore batho ba rona ba colluda ba tsentsha bana ba bona ba members of the clinic committees ba tsentsha their friends. Re tlo bolela le ntate le ba bangwe ba boletseng ka yona ba tla re fa those pointers so that we can go and look. If we have to go to protected land, that's what we'll do. Liko Orange Farm will also do the same. So on clinic committees, hali kan tumella setjhaba hore re fete ka tsela yona eo re ka thaba haholo. So Ntate Themba, we have noted your input regarding the ward-based outreach teams. And ke nahana hore Ntate Themba le yena o tswa ko Orange Farm, right? So re tla buleisana le yena mona hore a kgone ho re fa information kaofela re bone hore what is it that we can do to close the gap. But more importantly, pleke tsa rona tse sinang di clinic, batho ba nnang ko gaufi le clinic ba namelang di taxi tse pedi tse tharo, re ya kgona hore re lebelle area ya lona, situation ya lona re tsentse a mobile service. So re tla buledisana Ntate Themba re utlwe hore what is it that we can do to rearrange le ho add an additional mobile service mo le nnang ko teng. Ke a leboha. So ntho e nngwe hape ke ya ko Protea Glen, and coincidentally last week Chair ne re na le meeting wa AIDS Council wa the young people ba mo Gauteng. So one of the stream leaders, it's a young person also on Protea Glen who actually repeated the issues that were mentioned here. It's our clinic ya ko Protea Glen ke nyane le hona aisana capacity ya u service such a large population ya ko Protea Glen. So that is something that we are already looking into. We are not promising we re tla tlisa a new health infrastructure in terms of a clinic ko Protea Glen, but re tla lebella hore what is it that we can do or re kgone ho bona hore re stretch the services through the mobile services tse ka bang hona ko Protea Glen le hona. And mewa ko I think ke Dobsonville, re utlwile what you have mentioned. We know as the Department of Health, we are part of public service, and generally in public service we often, struggle to find employees who are always dedicated, always charged up, always excited to look after our people. So kinto re preaching every day. So hona jwale isingkhale, in the next 2 weeks you will hear we are going to set up a very large gathering where we are going to take quite a number of our employees in the department, our EPWPs, our contract workers, le ba bangwe ba hirilweng isingkhale. We are putting them in one room. We are reminding them about Ubuntu, exactly what you were saying, me. And I would be really interested to engage with you a lot more closely. Perhaps Rekau Shumisa, during the day, we are launching a service or a program which is called I Serve with a Smile. So we are bringing back the Ubuntu, inside us. Many of our workers, we are overworked, we are short-staffed as well. So even when we are working under those difficult circumstances, re tshwantse o re ska lebala hore re batho le ona re tshwantse re apply Ubuntu throughout the manner in which we provide our services. And it bulela hantle le rona ka hore akere re ko Department of Health nako tse dingwe le ha when we have the best nurses, the best doctors and the best medication e ka irang hore batho ba fole, but ha re sa buledisane le bona hantle, it defeats the whole purpose. So we are definitely going to look into that, and as part of launching program ya Nasi Ispani, that is what we are doing to improve the services. And we are also taking counsel, immunization in terms of working with the Department of Health. But what we should also do and be cognizant of Kuri, batho ba bangwe, for religious reasons, bana lutzia matsapa ya hore bona ba nyaki bana ba bona ba be immunized. So re na le mushumo o mongata o re tswele pele re fe di awareness programs as the Department of Health, le luna as setjhaba, as leaders in the communities. Let's continue to do that so that bana ba rona ba kgone ho kreya immunization di nomoro di kgone ho ya ko hodimo. Maybe let me end, Chair, by saying, and of course I'm repeating from what you mentioned towards the end, hali lebeletsi program ela ya emergency medical services, ela ya di ambulances, le tla bona hore in terms of performance, aya khona o reach 100%, akere? Mara ha re lebeletse tšhelete e ba e berekisitseng, tšhelete ba e berekisitse kaofela. I'm just talking about one program. So, hona le bothata ko emergency medical services chair. Just day before yesterday, mo Ekurhuleni, ko Katlehong, ambulance crew ya rona, it was hijacked at night, 10:30 in the evening. So, hona le the ambulances tsa rona tsena di na le very high technology. Re a kgona go bona hore o iralang. Ke hore le ya magodu a tsena a attacker, you know, basadi. We're talking about basadi ba tsamaisang ambulance, ba di paramedics. It's very painful. So, asi incident ya mathomo, re bile le di incidents tse pedi ko Tshwane. So re a le kopa hle ja ka setšhaba. People who are doing these things ke bana ba rona, ke batho ba re nnang le bona. But more importantly, le rona re a kgona ho ba tshwara. Ba ko Tshwane already they are going through the court process. Le bona ba mo Ekurhuleni, before the end of the week they will be arrested. Kauri, the evidence is just there, you can see through the cameras, okay? But ntho e re ikopang ke ya hore over and above or re re di ambulance a di fihle ka nako. Kauri ambulance e berekisa, you know, very intelligent, you know, plotting the maps. Ke hore ha incident ira ya ko Katlehong ko Ekurhuleni. So re a tseba or next time ha o phone o le ko plekeng ela a re sa kgone ho ritle ile ambulance fela. Re tshwantse re kope le maponisa re tsamaye le bona. So that adds on to response time. So ntho e re ikopang ke ya hore ha le utlwa hore these cases are going to court. Emelang le rona is the Department of Health. Re bontshe solidarity, but more importantly, the chumelo or the services tsena tsa EMS tsa dikoloi tse makilweng ha le di bona ko setjhabeng sa lona, you should know those are your equipment, those are your assets. O tshwana le di clinic le dipetlele, we must protect them. Gore le boshiu ha le bona hore there is something suspicious, as leaders in the community you need to try and find out what is it that could be happening. Karo bana ba rona ba banyane, HOD has to go and visit them today. They are currently traumatized. Ba ko dipetlele, ba tsere di phone tsa bona, ba tsere di bank cards, ba tsere le tšhelete. It's very painful. And ke basadi ba bangwe they were physically manhandled ba ba searcha, you know, on footage. It's totally ke ntho e utlwisang botlhoko thata. So re kopa hore le re thuse hle. Or service ena ya rona ya EMS improve, re nyaka go fitlhela di targets tsela. But ka taba ya ba re na le bothata bo, it becomes very difficult to respond ka nako. Ko plekeng tse leng high risk, all those areas are already plotted, marked out. So really kopa hle. Many thanks.
Thank you, Chairperson Rishile. The first one is around the HIS. Chair, we have since improved all our facilities, that is the all hospitals and all CHCs. We have now rolled out the health information system, and of the 4 modules that we are supposed to implement, 3 are fully implemented. That is patient administration. You could have heard the Premier talking about, and the MEC, 1 patient, 1 file. We have since realized that. So if you have consulted at Barra, and then tomorrow you go to Charlotte, we can now see you because we are giving you a new, you know, patient. I don't know, that guy is raising his hand. We now give you 1 patient number that we identify all patients within the system. But the problem, which is outstanding, is that at the moment we still have got to digitize all the documents over the years. So the system at the moment does not cater for that, because of we have now decided also to reprioritize our budget to focus on 3 main projects, which is the HIS, the queue management system, as well as the radiography system, which we call PACS, the picture archiving system. Chair, with regards to the appointment of female managers, yes, we have dropped from, from 47 now to 5. The challenge being that most of the women do not apply for positions, and even if we headhunt or we approach them, most of them do not actually show interest in our positions, especially the chief director ones and the CEOs, because those are contract positions. So most are reluctant to move from that to from permanent positions to that, but we are working very hard to improve on that one. The next one is around the attitude of staff. We have launched a project that is called I Serve with a Smile and Care, which we have already trained most of our staff in all the facilities. But we still encourage the community that where you encounter you encounter challenges with regards to the staff attitudes, you can actually report those to management, so that we can address it. So we cannot continue to allow that, and also that we would be taking disciplinary measures because we've now started with that particular training, and this is a matter that has been troubling most of our systems. So please feel free to actually report such. And then the other one that was raised, Chair, is around the cleaners in the clinic. We're gonna be looking at that and see what could be the challenge in all those institutions. I'm not gonna dwell much on the, allegations of nepotism, where people appoint their own families. There's nothing wrong, in terms of the constitution of the country, that people can be appointed, but they will have to follow the due process. For instance, if I've got family members that have applied for positions somewhere, I cannot be part of that. And if there is evidence that there is wrongdoing, I'll encourage you to report it to management so that we can deal with those issues. It's wrong if, with regards to all this, in all these appointments, policies are not followed. So we will be focusing on all those issues, and if you report them, we are going to give them attention, to ensure that, the process that has been done or that the process followed is above board, that everyone came into the system through a proper process. Chair, those are the issues that have been raised, in the corporate services portfolio. Thank you.
No, Chair, maybe over the input of the members, I think, they welcomed, and because they retusha or level the areas that can improve and the areas that concern member raise NHLS. We are also deeply concerned about NHLS, given the amount of money we are spending, the speed of the test, the accuracy of testing, and the duplications by running some of the tests. So we've got a task team that's working with the department in trying to get to the bottom of NHLS issues. I think let's say maybe report, because Haraya ka in details the issues that raised in AG renale and action plan ya tsona. Most of them keep a portfolio of evidence ya mmereko re irile o tshwana le the register tse di complete wa go di clinicing for the immunization ke tsona di timelang di a thapa di nela ke dipula. So that type of information I be verifiable. Issues here the asset management, the department, because the department the asset they are move around and arena electronic system ya we manager is some of the issues as far as audit issues are concerned. Chair, Chaba se raised a whole lot of issues my colleagues have raised and addressed some of them. Maraona the cross-cutting themes, we will take them back and we will encourage that the specific issues, issue as that Mr. Kobo, you attend to it directly, get the details, or a Tirelen clinic, those that were specifically raised, we're then able to deal with the individuals who have raised the issues, feedback, or share the plans around the issues and there are issues that the chairperson has already answered on our behalf, issues about presentation, clinicing, the immunization programs and all those issues. Maybe Chair from Corona, I think more departmenting has not delivered to expectations. What we must constitutionally do, but also the complaint maybe the raising on the spot, on the side, so that the issue gets dealt with immediately, other than it becomes more difficult to go back to the issue and try and deal with it. But like I said, on cross-cutting theme, our staff must be trained and the issue Ubuntu and let the program launch I say with a smile. Hopefully it'll be one of those programs that we improve the image department. Chair, maybe let me stop there. Give the opportunity. Thanks so much.
Thank you very much, Acting HOD and the team for responding. Where there is a need for extra space, also consider providing the space. Mr. Kobo, uba kuile ba ditaba tša bona di kwa ke ba bangwe akere. Ge motho a consulta o mongwe wa kwa e re isa ke Mr. Skukhuni mola. So go botlhokwa gore space se be enough gore motho a ska tswa ka mola a ipona gore yena o nyenyefaditšwe ka baka la gore motho o mongwe o kwele gore wo o bolaya ke eng. So go botlhokwa gore le di considereng tšeo. A ke tsebe gore Mmesara o ile kae. Mmesara a tla mpone ke pisi ya ka ye nngwe ke bereka le bothokoza gogo a ska tsamaya se ampone a ke mmone o chiefty. Okay, now ka ntle le go senya nako ke rata go tšea nako e ke le lebogeng gore le tlile meeting lena setšhaba iphaphathele matsogo. Ke leboga gape le Department of Health and Wellness under the leadership of Mr. Malotana, the acting HOD, who prepared a report by Tishamo for Lenas Chabali interacted Leona, Ebeli Raisin, Liche, the Weche, the Lithuanian, Jolekas Chap, Rally Lebura department, the presentation Yalina. Eleboa Pelidi committee coordinators, but making sure committee coordinators. Le Hansati irona ka mola I capturile everything le ba di tolo kire ba leboga ba bemba thusa hore re tsamaeng kaofela go sna ba re ba siang ko morago di official ka moka tse di tlile mmore le leboga le di staff sa legislature including the officers. I've seen 4 already. Re leboga mmereko o le re thusang ka go coordinator especially ko morago gore meeting wa rena o tsamaye gabotse. Ke leboga gape le honorable members ba ba tshwarang department e ba emisa ka loto le one ke mmereko a rena mo a re ba emisa ka loto le one gore ba continue ka nako tsotlhe ba dira se se tshwanetseng e nke le phaphatheleng komiti e matsogo. Mr. Kobo, we go reka di tepe tsa di plastic o ska tlhola o reka tsa di cheap le rena ko magaeng a rena magodu ba rutswetsa re lokela tsa di plastic ya re sa lokela tsa di cheap because ge ba di utswa ke batho ba ba yang sepetlele or ba ba leng sepetlele le nkweng ga botse a ke re di utswa ke ba bereki or ke di visitors ke re di utswa ke batho ba ba yang sepetlele ba di utswa. So o reke di plastic gore di be useless because they are all over in the country. So ke nagana hore ke announce hore ba berekisitseng di metšhini ela ya translation ba etla ba tlo e koleka ba feng yona ke le boditse gore e na le tracker kere o bereka mo fela o ska mema maphodisa gaufi le wena ka ntho e sa tlo go thusang ka selo so ba di koleka as re bolela so e re ke tšee nako e ke le reporteleng gore ge o se official ebile o se wa go tsena ka mo ka go kgethiwa ka letsogo ka di-election tša 2019 o se go ya ka mola ge batho ba ya ka mola please because go ba le tlhakatlhakano ka mola and o kry gore a re sa tseba gore mang ke a re nyake go koba batho ka mola please go na le ka mokgwa o ba tlo caterelang for everybody ka mo ge re tswa ka mo mola mo monyako re tlo kry-a packet ya rena ya dijo gore re kgone go ba le seamaleng re se ka tsamaya mo re tshwere ke tlala e re ke tšee nako e ke le leboge meeting o fedile ba tswile tseleng ba bangwe